All right, in today's PICS Parenting Plus, the building blocks of bonding with your newborn, the essential guide to clarifying misinformation when it comes to connecting with your baby.
The book is written by the spokesperson for the American Academy of Pediatrics, Dr. Joanna Parga-Belinkie, who is joining us this morning. So good morning to you, Dr. Joanna. Great to have you on.
Good morning. It's so wonderful to be here this morning.
So I feel very fortunate because I bonded with both my daughters very easily, but bonding doesn't always happen instantly for everyone. So what are some of the reasons behind that?
Yeah, I mean, if you think about the time right after delivery, it's a really emotional time for the parents and especially the birth parent. And so there's a higher risk of things like postpartum depression or anxiety. And I deal with a lot of babies. I go to a lot of deliveries. So it's not uncommon that people won't feel that bond instantaneously. And that's okay, because really what you're doing with a new baby is building a relationship over time and letting your love grow.
So what are some steps that parents can take to bond with their new babies?
There are so many things you could do to bond with baby. I think what makes it difficult is it's just such a demanding phase of parenting, and they can't talk to you, right? They can't have a conversation like we're having right now in order to cement that bond. So you have to be a little bit more creative. You have to do active listening, reading to them, incorporating them in your daily life, and doing your activities with you are some great ways to do it. And another one I love is something called serve and return, where they coo or babble at you and you respond in kind, not using words, but using those coos or babbles. And you have this back and forth that really starts to grow the brain, because really it's about having a loving and attentive caregiver that helps baby's brain grow and helps them attach with you.
Oh, that's so cute. They can coo. But obviously, like you said, babies can't speak. They can't use a language. They have their own little language. But what would you recommend for parents, though, in understanding and responding to their needs? And obviously that changes as they get older.
I think what parents need to know is that the foundation of baby's brain growth is a safe, stable, nurturing relationship with a loving, attentive caregiver. So you don't have to get it right. There's not some magic way to interact. You just have to be consistent, and you have to be really thoughtful and engaged. And again, the serve and return is a great way to do it. And I mentioned reading, just sitting and reading with them. And then I used to love folding my laundry with the baby. I would describe all the different pieces of laundry. I would sort of like wave it in front of them. And so there are great ways, again, to just kind of incorporate them into your daily life and make sure they're a part of it. And if you don't get it right, that's okay. Again, there's not one magical thing to do. It's the effort that really counts, and babies know you're putting that in.
All right, I'm going to switch gears now and ask you about vaccines. Very much a hot button topic right now. Are all of them important for newborns?
So there's a vaccine schedule that the American Academy of Pediatrics has that is very well vetted. Many pediatricians use it in their offices, and that's what I recommend parents look at. There are two vaccines for babies, the hepatitis B vaccine and the RSV vaccine that can happen right when they're born. And then babies get vaccinated at 2, 4, and 6 months. And this schedule is made to protect our most vulnerable babies from infection, and their immune system is ready for those shots when on that recommended schedule. They're something that is recommended by the American Academy of Pediatrics. So I definitely think all these vaccines are just really useful in protecting baby from bad diseases.
Okay, let me tell you this much, and I know obviously you know because you're a parent. The one thing that changed the most drastically when I had a baby was the amount of sleep that I got, because that's one of the biggest complaints from parents. I'm not sleeping anymore. So the question is, though, is sleep training actually effective? It did not work for me. But can it be?
I'm so glad you shared that, because it doesn't work for some families. So when people ask me about sleep training, should I do it? Should I not? I say you really have to examine your family values. Now, I think the really important thing to know about baby sleep is they just do not sleep like we do. And so while we like to get a nice 8-hour chunk of sleep at night, babies will sleep up to 18 hours a day when they're newborns especially, but it's going to be in fits and spurts. So it's not going to be in this one period of time. And that is just absolutely exhausting. So as a caregiver, make sure you have other caregivers around you to help, and you don't have to sleep train baby. They're not programmed for that. But hopefully by a year, most babies learn how to sleep in bigger chunks of time, so you'll get some relief then.
Can I ask you
get some help before then?
Can I ask you a follow-up on that, though? Because Sometimes
Yes.
some people recommend that you wake up a baby. You're like, oh, they're sleeping too long, wake them up so that they're not awake all night long.
So that recommendation comes from the fact that newborn babies need about 8 to 12 feeding sessions in 24 hours. And so you want to get those feeding sessions in, especially in the beginning, to make sure that baby's going to grow and thrive. But once you start to go to your pediatrician, you've started to know that your baby is growing well, you don't have to be waking them up at night for all of those feeding sessions. It's just kind of more something we recommend in the beginning to get feeding established. And you want to make sure that that baby's getting the nutrients they need to grow.
All right, Dr. Joanna, thank you so much for joining us here this morning. The Baby Bonding book, Connecting with Your Newborn, is available wherever books are sold.
Don't you just want to have kids now, Justin?
Listen, the lack of sleep.
You get over it.